We are having incredible feedback from our employees about access to healthcare.
Now that you took ownership of your healthcare benefit, you created your own plan, and now they're using it.
Yep.
You know,
Open the phone.
and send a text 24/7. That is a win immediately. Your service is very affordable. Your service proves itself to be incredibly valuable over and over and over.
I think that's important too, is that people are not worried anymore.
Healthcare has not been a subject. I do not hear about it now.
This is the Voice of Value.
I'm Dr. Roger at Direct Med Clinic, sitting here with Bill Roberts from T&D Moravitz and Allison De Paoli from Altique Consulting. We're going to talk about something that is super exciting and very groundbreaking as far as benefits to employees. So, Bill, do you want to give us a little background of the company, and then Allison, you can do the same.
T&D Moravitz is a 51-year-old company that does concrete construction work. We have about 140 employees. I have been CEO and president since 2017. It's just a very dynamic, active company. It's kind of like a rodeo in the construction world.
Great, thanks. Allison, want to tell us a little about yourself and what you do?
My name is Allison De Paoli. I am the founder of Altique Consulting, and we help employers apply sound business practice to healthcare decisions, which means lower costs for employers and better access to care for employees.
Great.
And we do that with your help.
Excellent, thank you. I'm Dr. Roger, Direct Med Clinic, and what Direct Med Clinic is a direct primary care clinic. I've known Bill for a while and the company. We work together a little bit on some things, but what I'm super excited about is the literal health plan that the company has put together, and I wanted to have Bill talk about that a little bit, about this innovative plan, and you can help us with that, Allison, some of the innovation that's happening here and why it's such a groundbreaking thing that's going on here that I just wanted to share with people. Because out there in the world of employer-sponsored health plans, it's a struggle, right? To have affordable access to care.
It's quite a struggle. It's a never-ending series of price increases and closed curtains that you can't figure out what's going on. Why did it do that? And well, it just, you had a high claim, so your prices have to go up. You spent more than you were supposed to. Well, I didn't spend anything, but the price keeps going up and the price keeps going up. And it's frustrating for me as a business owner to try to absorb that every year and keep our focus on quality care. It's a very important tool for attracting good people, is to have this very good health plan, and it got more and more and more expensive. And I just, out of frustration, we had a relationship with Dr. Roger and Direct Med Clinic. And so we tried to experiment with, how's that going to work? How could that be our solution? Could that be the thing? There are some very unique things about what he provides, that it's a flat fee per employee type arrangement. It comes with unlimited medical care for the services he provides. He's your primary physician. His team of doctors are all excellent. And the prescription drugs, the mainstream prescribed drugs, are available at no cost through this service. So it was a huge first step, but it didn't quite close the gap on, is everybody covered like the law says I have to cover them? Is everyone covered adequately for the ancillary products that, where do I get those? How do I do the life insurance and the dental and the medical and the things that glasses, vision, all that kind of stuff? Where do those come from? How do I close that loop? I couldn't do it. I couldn't figure it out. I saw Allison's book. It was a very enlightening and disturbing read at the same time. It made me feel completely stupid and taken advantage of by some of the insurance people, but at the same time, it gave me some hope that maybe there's another way. Coincidentally, she said in her book, call me if you need something. And I did.
Well, thank you for that.
And she immediately responded. She immediately took the reins and started to explain to me how things worked and this kind of thing. But the nuances of the healthcare program that we have actually been a part of with them were not clear to me until we actually got a little further down the road. And those things were, although you say groundbreaking, I don't know they were groundbreaking. They were just filling in all the missing pieces that I thought I needed for a complete program for my employees.
Was it a surprise as to how, okay, it's a big lift to move from a fully insured plan that you had into a completely what we call unbundled self-funded plan. So there's a lot of work there that doesn't really land in your office. Were you surprised at how simple it was?
Very much. My previous agent had helped us explore self-funding options and that kind of thing, and they turned out to be nothing more than hire the insurance company, the very same insurance company, and pay the freight, and take the risk. This is a different deal. This is something where she's set us up with half a dozen different consultants and firms, specialty firms, that handle the gaps and handle the risk and handle the day-to-day management of my employees' claims and where they go and who they talk to, and not to get the care, but to get the actual insurance payment.
So maybe what's different that you're describing here is you liked what Direct Med Clinic offered, which is called direct primary care, which is growing among employers year over year now. You didn't have the pieces for the higher level of care. And that's where the book and then consulting with Allison came into play. And you were able to see how, with her help, that these other components could be added to the fixed cost that you'd get for all of this care through direct med.
That's right. That's right. Your care, your service is 80% of what an employee needs.
80 or 90.
Or maybe more. I mean, so I just needed to understand how to close that circle, how to complete the deal, so to speak, so that the employees stepped from one program to another, which they were no strangers for, because every year we're forced to shop every year because the prices have gone up and they get a new card with a different name on it. So, it's not that they're unable to adapt. It's that I couldn't be comfortable understanding simple questions like, what about the emergency room visits? Would I just get a bill? How does it work? I don't understand. Well, she cleared that up with an amazing group of businesses that are well established and very capable of managing that. And to date, we've been on the program for 2 months now. To date, we are having incredible feedback from our employees about access to healthcare, which is you, lack of drama with the insurance portion of it, which is you, and it's working. So I'm very excited about it.
Bill, what were some of the things that you were worried about or scared about by making this big change?
Would the employees use it? Would they trust me? Because they're very temperamental about change.
Most people are.
So would they use it? Would they trust? Would they enroll? And then, are we truly protected? What were those details? I needed to understand how that was going to work. And the answer to that was extremely exciting when the director of the program, the captive is what they call it, came and actually explored with us what they do. And it's just fascinating. Too much detail for here, but.
Can you talk a little bit about why you found the idea of a single parent captive so interesting?
The analogy you used is that you're actually renting or buying a room in a hotel, but there are many more rooms. That analogy made sense. Those rooms help you cover the costs, participant in helping cover others' costs if they run over, if they have that damaging claim that normally would be the thing that would throw an insurance company into tailspin about your plan. And it's a self-protected group that you're relying on, 60, 70, maybe more people, or not people, but companies that are doing exactly the same thing we're doing in this captive and protecting each other. Fascinating.
Was the idea that everybody's interest was in alignment important to you?
Very much. Very much. I can't I don't want to get into a deal where there's profit taking or there's like, I'm doing it for a motivation other than quality health care. You know, I wanted to get into an arrangement where the basis for success or the measure of success is everybody's healthy. We got out in front of it with proactive healthcare visits, relationships with a doctor. They understand what's going on. We got out in front of it with pharmacy benefits that lower the cost of the stuff to us. It was a little unnerving that I was actually forming an insurance company at T&D. That was a little, but now that makes perfect sense because the curtains are gone now. I see with clarity what's actually going on, and I see that the risk is not what I perceived it to be. That the risk is what the insurance companies, the previous healthcare companies, insurance companies described to me as a future failure point of my company by taking on this risk.
You see, I
not
think
the
that's
case.
so amazing that now
Yes.
you own your health plan, right?
Yeah,
And
right.
I've worked with employers, and Allison has too before, that struggle to get their information, you know, like their healthcare information, what's costing what and all that. But now, in a HIPAA compliant way, you have access to all that information.
Yeah, I don't know details about each employee. That's not the point. I understand costs and the effects of those costs and how those costs are being managed. And I understand that a certain prescription that really should have, normally would have cost me, or I have reports from my previous guys that cost me $10, $15, $20,000 a pop, can be managed for half that price.
Yeah.
And that's probably the real price.
Right.
In all honesty.
Yes.
And
It is the real price.
I'm paying retail and they're paying discount,
right.
and that
That's
gap
right.
is there. That's what the insurance companies are protecting.
So that's one of the things we do at Direct Med Clinic. As a clinic, as a doctor, I have access to lab pricing that's way different than
Way
someone
different.
pays
Way
through their insurance, and imaging as well. And when we partner with a company, we pass those savings on.
A good example is your full cost for a set of blood work that is very thorough is less than the copay my people had to pay before.
Isn't that
Correct.
cool?
I mean, and then the insurance company bills another 5 times that.
That's right.
You know.
That's
And then they tell me at the end of the year, I spent too much money. My rate's got to go up.
So what I'm hearing you say is that you now apply business practices from your everyday life into your health plan.
Of course. And my business ethics too. This is a very straight up, responsible, fiduciary type duty. It's no different than a 401k. These are my employees. I'm taking care of them. It's my fiduciary responsibility to provide them a program that will not damage them. I think we're doing that.
I think you are too. The first couple of times I talked to you, you said a lot of things to me that I have heard before about being unable to understand what's going on. What was the final breaking point? Was it just the last crazy price increase?
The actual thing that got me, it wasn't the price increase, it was the feedback from employees that would stop by my office and say, hey, I've been fighting with the insurance company for 4 months to get my prescription that I've gotten for 6 years before this, and they won't give it to me anymore for some absurd reason, and I can't find out why, and I need my medicine. And that happened a lot. It's like, well, what are we buying? What are we paying for in the first place? And why do I have to pay more if I'm not even getting it in the first place? And so that frustration said, all right, it's worth the risk to understand what you're offering. And then by simple education and question and answer sessions like you're talking about, it made the jump for me simple. For some of my employees, doubtful. For the vast majority of them, it was just another insurance card that showed up.
With the doctor.
With a doctor, yeah. But now they understand. Now they're starting to use the program. They're starting to reach out to your clinic. They're having their initial visits. They're talking to you about things that only you know at this point. And they come back encouraged and happy that gotten that off their chest, and there's a forward motion on whatever their problem was. When somebody has, well, honestly, we haven't had a problem with getting a prescription at this point, but now if we do have that problem, we have direct contact points to go to that will fix the problem. We can address it now. We don't have to wait for some system some bureaucracy to fix it for us, you know.
Were the number of breakpoints surprising to you?
Well, when you decide that all the noise around you is actually a message, then you realize you've been not hearing a lot of what you should have been hearing all along, you know. And just going with the annual renewal, pay the price, just do the renewal, pay the price. Yeah, it's surprising now. But there was no option. I did not know the option. And I don't know that, you know, I'd like you to talk about a little bit about what's new and what's innovative about this, because I feel like we're cutting some new ground here in what we're doing.
Yes.
In San Antonio, we are cutting some new ground. We have a lovely group of clients. They don't all let me do what we did for you because it's a big change in how you engage in the healthcare system. And one of the things that I think is always so surprising to people who do make changes in their plan is that you see where things break. Like you can see now where things are breaking. You can see the fix, right? But you can see the break, right? You can see a wrong ID card at a pharmacy. That isn't the fault of the insurance company or the employer. The default is, well, I have bad insurance. Nope, somebody used a wrong card at a pharmacy. Well, pharmacy people are busy. It happens. Mm-hmm. When you have a shorter distance between the payer and the patient, then those problems get solved faster. They don't have to go through 5 levels of bureaucracy, and those 5 levels of bureaucracy don't need to be paid for.
Yeah.
So if there's a situation with a doctor, we can fix that fast. And it's interesting to me when patients have an experience with the administrative side of healthcare, because there's a very large administrative side of healthcare, and how angry they are at that. But then they just get rerouted along and they get rerouted around and they're like, oh, okay. Mm-hmm. And off they go and they're okay. And it also is very interesting to me that people seem to intuitively understand that medicine costs too much. And when we can change a few things about how it's delivered, it's no problem, especially when it costs half.
Yeah, the cost is reduced.
Sure.
Right. This is a great opportunity for my employees to take care of themselves. You know, many have taken advantage of it. Many are of the mass group that we have of folks that kind of don't take health insurance. You know, they go to Mexico.
That's right.
And
I've seen a lot of them that are coming to the clinic now that were going to Mexico for their care. And I think that's amazing now that you took ownership of your healthcare benefit, you created your own plan, and now they're using it. They're not going to Mexico.
They're not going to Mexico.
And just as a
That's
frame
a
of
great
reference,
thing.
Mexico's about a 3-hour drive from here.
Yeah.
So rather than going on a 3-hour drive, they're taking a 20-minute drive south.
What do they do
Or
if they need acute care?
Yep.
Open their phone.
Yep.
You know,
That's
and,
Open the phone.
and send a text 24/7. You know, this hurts, that hurts. What should I do?
Right.
I mean, and get a doctor's opinion and that knows them, not a doctor that is
Somewhere else.
doc in a box somewhere else.
Right.
That's like, tell me about yourself. Well, I'm sick and I don't want to talk.
Right.
You know them, and then you have this phone box, phone relationship with them that is very effective, and you know what to give them, and you know what their constraints are, and you know what kind of medicines they're going to have a problem with, and that kind of stuff is that's the feedback I get now. Mm-hmm. Is that, hey, that was pretty good.
So they can text us.
Mm-hmm.
They can get in same day or next day. What other benefits did you create in your health plan for your employees, like co-pays and that kind of thing?
Well, we tried to keep co-pays to 0. Mm-hmm. And it takes a few simple steps on them. They need to meet you or your team. Mm-hmm. They need to go through the first little process, and then whenever they have an issue, they need to resort to going through direct med first. Well, that creates a 0 copay, 0 across the board for 95% of everything that they're going to go through.
So that is so amazing that you've structured it that way. You didn't force anybody to do that, but you incentivize them to use us, because if they do, then there's 0 out of pocket.
Absolutely. We offered direct med method and the out of network type method, 0 on one column, and 50, 250, 500, 5,000 per group, per employee, 10,000, 12,000, whatever for families. Huge amount of money for them, for me, anybody. And the mystery is why they don't all use it and jump on it, but they will adopt it.
Right.
because the feedback is positive, and when the grapevine's positive, action gets taken.
So I
I'd
get
agree.
questions frequently from other people I'm talking to about what we do, and they're like, the employers are asking me, well, how many locations do you have? And I always tell them, it's not so much about the how many locations I have, but it's about access to a doctor, right?
Mhm.
You have the same doctor. You can get in same day or next day. You can text us. One of the things that we realized we were doing early on in the early days of the clinic is we're actually restoring the doctor-patient relationship the way it used to be with our parents, right?
Right.
They could call a doctor who knew them and get care.
And speak with them. Yeah,
Um,
that's right. And it's effective. I've used it myself.
Mhm.
You know, I've gotten calls from you. I've gotten calls from your staff quickly and effectively. So it's not, sometimes I just verbalize a frustration. I don't like how this is going. I want to route it through you, and that's what happens. So
What do you think you'd like other business owners, Bill, to know that are struggling with the high cost of providing access to a doctor or a healthcare benefit?
they just need to know there's options. There are choices that I consider better choices than simply being led down the trail by the insurance companies and the various brokers with their healthcare plan. Even when they're talking about self-funded and trying to show you a way that supposedly will put you at risk and take them off of risk and put all the savings in your that's baloney. This is a truly self-funded, self-managed plan that works, and it is working beautifully. The people, the parts, the components, the mindsets of all the people that contribute to the success of this thing are all in one direction, and it's not about making money, it's about healthcare. It's about positive effects to the healthcare.
Would you say
I
that
can't
all of
beat
the incentives are aligned? What you wanted for your company and your employees are aligned with what I do and what Allison does?
Yes. I mean, I don't think I would have taken the leap if I had a doubt that this was not an outcome that would not take down my company. I don't want to get into a thing where there's too much risk, but the risk aversion and the risk details are clearly described, and there are overlaying layers of protection and stop loss that made me perfectly comfortable taking that jump.
That's awesome. And you mentioned Allison's book. She also has a documentary where you can see clearly how some of the incentives in healthcare are way out of line. So this is a beautiful thing when the incentives can come together and be aligned. And so there's no doubt in my mind that this is going to keep working as planned, as projected. As it does, how do you think it's going to benefit your company long term?
Just by having healthcare at the level that we had it previously, it's already an attractive thing for employees of other companies to want to come work here.
Well,
that's
awesome.
what I need.
Yes.
I want more. I want
And-
the good people.
And just for the record, T&D Moravitz, Bill's company, is in the top 10 best places to work, best companies in the San Antonio, according to the San Antonio Business Journal.
Yes.
So kudos to you for creating that culture already, and I'm sure that this is just going to elevate the culture within your company as well, and make it an even better place.
Well, to finish off your question, what I need for this to actually go is the positive review from the employees to the street. I want them talking about it at home. I want them telling their cousins and their brothers and their uncles and their friends, hey, this is a good place. This is a good deal.
Yes.
I'm taken care of here. Healthcare is a very important piece of this being an attractive place to work.
Excellent.
And we couldn't do it without it.
Excellent. Allison, your comment on that?
So I think what we have done is relocalized healthcare, which I think is important for several, not just for you. I think when we can relocalize healthcare, we make your costs fair and reasonable. And I think we all understand that healthcare delivered to the right patient at the right time, at the right place, is usually not that expensive. But the other thing that we're doing here is we're keeping the dollars in San Antonio. And I think that's good for our community as a whole.
That's right.
And we're all working towards doing this for more employers, because then more dollars stay here, and we are a robust and growing community with a very healthy local ecosystem.
Mm-hmm.
And My personal goal is to try to keep that going. I think the more dollars that stay here, the better off we are. The better it is for T&D Moravitz, the better it is for the employees of T&D Moravitz, and the better it is for our local community as a whole. Personal responsibility is a core value here at T&D. And how does this allow you to extend that into your health plan?
Just by having awareness. The decision point. Before I didn't know. Somebody else is making the choice. Yes, no. I don't get to pick whether the patient gets the drug. I get to pick the pharmacy we buy it from. Indirectly, I mean through you, but I get to decide we can save money here and take advantage of that and still give them the exact same prescription because you had a firm that would research the price all over the country and find it at the best possible price. No changes in the prescription, no modifications. I have zero control over what the drug is, but where it gets purchased, and it's all automated. It's all happening as I speak. That's the default response. We found that drug here. It can be here in one day. It'll happen, It's been done.
Did that surprise you?
Very much. Very much. It's completely input free, but it would have been a decision point for me. And the decision's made it by default that I want this for my people and my company and my employees, and our future is dependent on good decisions like this, and it works. It just works. It's fantastic. I love it.
What was the most surprising thing that between Dr. Roger and I that we told you?
I think that, we are already impressed and confident with Dr. Rogers' program at Direct Med. We, as our primary care physician, switch over, we were already confident that that was okay. When I found out that simply by routing first call, that's all it has to do, the first call goes through him, then the employees are relieved of almost all of the financial responsibility for that. And that surprised me. Such a simple change in what you do. Do not go to a separate doctor. Do not go to a direct med clinic. I'm not talking about this, but
an urgent care clinic.
Urgent care clinic. Do not go to any sort of commercialized doctor arrangement. All of the emergency centers that are popping up everywhere that have 27 beds and all they need is one patient to pay for the whole gig.
Right.
Don't go there.
We tell people that we want to be your first call for anything medical.
Absolutely.
And
anything.
we tell you and everybody else that we want to keep people out of the urgent care and out of the ER, out of the hospital. And we can do that so easily if you just give us a call.
And that's what surprised me. And it takes both of you for that to occur. The what you each provide independently and now together is what makes that work. It goes through you so that it goes through her. Mm-hmm. And that solves the problem for the employee and me, quite frankly.
Yes.
That's the biggest surprise.
So there is a change in the administrative workflow from a fully insured plan to a self-funded plan. But were you surprised once it was implemented that nobody's calling you about everything that's happening?
Yes. I mean, I see summary reports and lists and things like that on a regular basis. That's enough information for me. I don't get any specific personal data with that. I just get group. Very similar to the kind of information I might have seen before, but it's twice a week or twice a month, and then quarterly. And they're just all kinds of reports that let us know how we're doing. And,
is that important to you?
Well, it certainly is to try to understand that I make a decision that is going to have a long time benefit. Am I going to be able to stay with this and that kind of thing? Costs are getting managed. Things are coming in right where they should. Right where healthcare is not free. Healthcare, this is not a free thing. This is a control your own destiny type thing, which is really what I'm after. We can, if we choose to upgrade a service, if we choose with some savings, if we choose to give a holiday on the rates for the employees, give them a month off of having to pay for healthcare because we save money. Those options never existed before.
Yes.
And that's what's possible now.
Allison, I'm impressed at how quickly this happened once the decision was made, right? How quick did it happen?
It happened in less than 30 days.
Yes, it did.
Wow, that is quick, right? From fully insured
Yes.
to owning your own health plan.
Mm-hmm.
So I think the key there is the decision, right? The rest can happen in less than 30 days. It's a little messy on the backside, which I'm not sure anybody noticed, so I'm going to consider that a success. And it can happen in 90 days, right? But a decision has to be made.
Mm-hmm.
And I think that is the most important thing, is to decide, do you want to control your destiny here, or do you not want to control your destiny here? What we did here is not right for every employer. I would argue it's right for most.
Mm-hmm.
It's right for us. It gives us the control we're anxious for. My partners, all excruciating decision making about who we're gonna, we have to find another healthcare agent, all this kind of stuff. Those conversations are now a thing of the past, because we have so much information about exactly what's going on and how it's working and what the deal is and where that's protected and what ifs, and all those scenarios now are answered by a page in the book.
Data.
Data.
Basically.
Data.
It's just, it's just fantastic. So we're excited about it. I personally am enjoying the path, with my personal health care in this plan. I get the exact same thing that any employee in the company gets. It's not like Congress or anything like that. I'm very pleased with what's going on.
Is that important to you, that your healthcare is the same as everybody else's?
Absolutely.
And that it's high quality?
I'm not going to accept healthcare that's not of a quality that I think is going to extend my life. I'm not going to accept it. I'm going to be the guy that's pounding my fist. But in this situation, the right answer is always the default answer, and the more positive path is always chosen. There are occasions where, the costs are the costs. A patient needs something significant, and we still are able to provide that. That's all preordained how that will be handled.
Was it important to you to be able to set your own rules? Because I came in here one day and asked you a lot of questions.
Yeah.
You were like, what now?
Yes. I mean, it was important and overwhelming, but at the same time, it became a custom plan. You could choose extras at that time. Yes, I want that benefit. No, that is not important to the group. And exclusions and things like that, they were minimal. I mean, but they were the advantages were great, because it's just more of that transparency. I understand now what the decision making process is and how it should go, and what kind of things by default were not available to my employees before. That I can just simply say, yeah, let's do that one.
So one of the things that I heard was very challenging, and when we looked at the limited data that we could have.
Right, they don't tell you everything.
They don't, where we could look at drugs and say, cost too much, cost too much, cost too much. But I think one of the challenges you had is there's simply drugs were not covered that should have been.
Yes.
And you had some members that were paying a fairly significant amount out of their pocket to get a medication that was pretty standard and medically necessary. Have you eliminated that problem now?
I think it's still out there for as far as drugs can cost money, but the price tag is substantially reduced and pleasantly visible to the employees. They're like, oh, that's free, or it's only $100. It was $4,000.
And we just expanded your formulary. We did not contract it.
Right. And it's just fascinating how this is not a bargain deal. This is not a we're not cutting any corners. We're giving first class, all in, everything that we can possibly imagine type coverage that I don't think we had before. I don't think we've ever had before. Just to say, kind of maybe backtrack a little, when I would get the disturbing reports at the end of the year when it was time to renew the policies, the vast majority of the time it was, you have 4 or 5 people that have conditions that require huge amounts of prescriptions, the most expensive prescriptions ever, from a $3 million shot to, I don't know who the people are, but then to all sorts of cancer treatments and various other things that these drugs are just astronomical, and you just spent too much money, and now I know how much it really costs. I know what we can get it for. Sometimes, there's a giant savings. Sometimes there's a mediocre savings, but there's always a savings. It's always cheaper.
Mm-hmm.
We've cut the middle dozen men out of there,
Yes.
not just the one
And,
middle
and it's
man.
become transparent too.
And it's
Right.
to us. It's just a great thing. Knowing is much better than not knowing.
Were you surprised at the number of times somebody said, well, yeah, you can do that if you want?
Yes. Yes.
Because I think your pharmacy vendor said that a few times, and your third-party administrator said that a few times.
Right.
And everybody was like, we can do that?
Right. And okay, that's in there. That's basically all I said. That's in there. Yeah. Wow. It's good news. It's good news. We're young in the program. We have not had a catastrophic claim at this point that I'm aware of. Maybe one is brewing. I don't know. It seems like there's always one brewing. But that's the point of healthcare, is you got to take care of the people. And we have not had any pushback we're not going to mess with that, because we're going to mess with every one of them.
Mm-hmm.
And they go out and they aggressively mess with it. If you find a better deal, find a smarter play, get your advice, that kind of stuff.
I want to circle back to that, well, you spend a lot of money comment. And you have a couple of people that have ongoing medical issues. I think you were surprised when I looked at the claims reporting and said, well, there's not much here. And you had just been told that A, B, and C, and D were,
we're forcing
crazy.
a 20% increase in my premium.
And we looked at your most expensive claim, which was $175,000. And if there is no medical status claim, that claim will process at about $90,000 this year. You were pretty happy when that happened.
Of course.
And pretty surprised.
Well, you only know what you know until you know something else.
Yep.
I did not know what I did not know, because I wasn't ever able to get behind the curtain and see what I did not know and the inner workings of the thing.
I think that's really important, because I think so many employers are told, well, you just had this thing and you spent this much money. And one of the number one things I hear is, well, we have a number of sick people and we can't change, they cost too much money.
Right.
But when you identify what is the actual problem, what happened with you is quite common, right? It's not unusual to cut a claim in half just by sourcing proper medications and making sure care is delivered at the right place. That was very surprising to you.
It was pleasantly surprising to me. It's been a journey that, not that it hasn't had any negatives, it's scary, and it kept me awake at night trying to make this decision, and it was down to the wire where we were actually not even going to have time to print the books but from either platform because I wouldn't make this decision, and it came through. I'm not a risk taker, but I do take advantage of what I think is opportunity. So I think that's where we won with you guys, and we'll continue to win. And this is a long-term engagement. This is not a try it 1 year and ditch it kind of deal. For it to really spin off and make some positive impact on the thing, we have to go for a few years and make sure that this thing is controlling the rollover cost to the following year, and is controlling things, and perhaps even, God forbid, save some money that can be rebated to the employees. It'd be fantastic. But that's something we'll find out as we roll along. Right now, it's very encouraging. Our medical expenses are a fraction of what they were for prescription drugs, which has always been the highlighted excuse.
It is a huge driver for most employers.
They are a fraction of that. With the exact same people, with the exact same problems.
Getting the exact same medication.
Getting the exact same medication. Yes, that's right. And that is a win immediately. Your service is very affordable. Your service proves itself to be incredibly valuable over and over and over. So it's a good mix. Win-win.
I think it's important that the decision that you made is one that will last for a while. You might have to make some plan. We may want to do this. We may not want to do this anymore, whatever the kind of detail of that is. but now the basis of your plan is set.
Mm-hmm.
How long did it take you to make that decision? Because I think it's 2 decisions, right? It's were you going to change, and then were you willing to change for
That's
some
what
time?
happened within 30 days. That didn't take any time to do. I mean, you took care of that stuff. It was a series of documents to look at, a series of checklists to go through. Is this in, this out, this in, this out, this in, this out? Well, that tells me a lot about what I was getting in the first place. You know, everything is a place to learn, right? So I would see these things and call my other agent and say, hey, what were we doing about all this stuff? Well, that's handled by other people in other states, and we don't handle that. You know, zero info. And here I'm looking at the answers right here. I got to ask questions of them, and I already knew the answers, and that was a good thing, which sealed their fate, and they realized it. And they had advised me for years, and I'm telling you, years about self-funded is the direct path to crushing your company with medical costs.
I've heard that quite a lot, and it's a very frustrating answer to me.
Well, it's your whole market. I mean, the fact that is is the real answer. You know, that's the whole thing.
That's right.
Oh, that is another one I'm going to pilot for you.
I mean, it's just not the whole story. And, you know, once you get the whole story, you're kind of past the thing. You had to have a leap of faith. There's no question. You have to have a leap of faith. But it's not without documentation. It's not without substantiation. The players are all identified. The players all exposed themselves. Primary captive came to and sat in this chair.
He did.
Talked to us about how it works and what it's going to be, and explained that this is a multi-year thing. You know, you're in for 1, you're in for 2, you're going to see some benefit in 3, because we reserve that to protect you from yourself. You know, I mean, that's what it is. So by the time we get to year 3, I'm really hoping that there's a holiday on some of the premiums that we can distribute out in the form of reduced personal cost or for the guys. The guys only pay a fraction of what we pay anyway.
Correct.
But the benefit's going to go there first. Company's built to pay a certain amount of medical, and that's fine. But the way it will be received the most positively is to reduce their minimal exposure too.
What would you tell other business owners about what they could do if they're struggling?
You know, I prefer the whole hog approach. I think it is easier to make all the changes at one time than to make them piecemeal over time. I think change is hard for people, and sometimes a lot of change in a short period of time is easier than a little bit of change over time. However, this is not my business. So I have seen where we can move somebody from fully insured or very traditional self-funding, meaning your insurance company is now just letting you pay your claims as you go. They're not really managing your costs.
Right.
And then we can change the pharmacy, and we can add this little thing here, and then over time we get over here. So I think the choice is the employer's, but in all cases it is a decision of we want to do better for our employees. We understand what we're going to pay. And if the employees could pay a little bit less, that would be great. We're going to pay this. Could it work better? So that is the question to answer. Can it work better? Yes, it can work better. And it can work better quickly and change a lot and get a lot of better outcome. Or it can be a little bit slower and accommodate a different culture. This is a pretty rapidly adaptable culture, I feel.
I think so. And so the whole idea is get a look at your cost, your spending, and you can, with the right approach, you can see all of those components and then start to control them.
I think one of the most effective things is to start comparing your pharmacy costs. That is the simplest thing to change with probably the largest impact right now for the most number of people. And we can do that. You just need to get the list of drugs, and we can, depending on how detailed that is, we can ballpark and eyeball the really expensive things, or we can get down right into the nitty gritty and reprice your entire list of drugs, and you can see the difference. And for most employers, they're paying too much, but okay, fine. It is the specialty drugs. And those are driving, they're 0.5% of the scripts, 1% of the scripts, but they're driving 30 and 40 and 60% of the total cost. So if you can just contain that, you have a good start.
We have some real truth to that. As I'm looking at a 20% increase from last year's premiums, and then after seeing the prescription drug potential for savings, this could have cost this much, this could have cost that much. We did not raise the employees' take by 20% and the company's paying 20%. We passed the exact same money that we charged last year into this year's plan with good confidence that it's entirely adequate, that it didn't need to grow by 20% as described. So the employees didn't pay a dime extra for this. The company thus far is not charging a dime extra and not exposed to really a dime extra in cost. Because of the layers and layers of protection that we have, I think it's going to be fine. I'm wondering, curious, if we can reduce the cost next year because of how it performed this year, regardless of the patient's outcomes, whatever may happen, that claim, that surgery, or whatever had to happen. Just understanding the drug piece kept us from raising prices internally to cover what we think is going to be next year's cost.
Over the years, I'm sure you've been given some advice about how to manage the premium increase on your fully insured plan. Would you like to share what
write
you've
a
been
check.
told?
They'll finance it. That's the advice they gave us. You just have to pay it. That's the way it is.
And I believe the last piece of advice you were given was, well, just pass it through to your employees.
Well, true, but to me that doesn't even register as an option. That's not even a choice. It's not a choice. I don't think that because there was a high claim somewhere that I should act like everybody else owes for that. That's just how it is. And this person needs to survive and be taken care of, and that's just how that is. And I mean, I don't feel like distributing that cost to everybody. It just doesn't seem reasonable. And I decline on that opportunity as often as possible. But it's not because I don't want to bring profit home. It's not because I don't think there's risk in this situation for that problem. I don't need to raise the prices to the people that work for us because we're doing a better job of managing what the real cost is. We have a better plan. We have a real, in some cases, the first time we've ever had a plan for being able to understand what really we got ourselves into. Not just a monthly premium that goes off into the sky somewhere and gets bigger and bigger and bigger. I can see that in 10 years, the cost of healthcare would have been larger based on how it's happened in the last 10 years. It would have been larger than the company's margin in a year. I mean, there's no reason to pay that much money. I couldn't sustain it. I had to keep healthcare. There had to be another way. Our experience with you got us into the deal. You writing the book and it circulating back through to me opened the door. What if situations started happening? I talked to my partners, man, I think we may need to look at this. And in fact, they were in 100% agreement.
I want to talk about that a little bit because I think you did make this as a leadership team decision and there was majority agreement but not 100% agreement. I think you got a good view of how this change is challenging for people.
Yeah.
And it seems to have worked out okay.
We picked key people who we thought would dissent, would say no. And we wanted their opinion. We got feedback at renewal time, which happens frequently. I hope we don't change because I like X, some sort of a thing. And you get those kind of comments every renewal. This is not a huge company in the management side. It's a big company with all the field labor. There are 20 or 30 people that actually are in the administrative piece of this, and we would hear from them regularly. I can't get this done, or I love how this company does this. I don't want to lose it. And so we specifically asked those people to comment on this new plan.
I think that's important too, is that people are not worried anymore.
Healthcare has not been a subject of, that's hit my desk at all from the employee piece.
Great.
It is not something I hear about. I used to hear about it, but I do not hear about it now. It has not been, there's not, from what I know about the water cooler talk, there's not a lot of back channel rumbling, I think it's working.
Well, I'm super excited that the company, you and the company, chose Direct Med Clinic to provide this for you. And I love the fact that if I do what I'm trained to do well, it'll work really good with the company. And,
That's right.
And same with you. I mean, you've done this before. I've done this before with other companies. So we do what we do. We're going to make you look like a superstar.
It's a big step. It's a big step. I mean, I get anybody that might be struggling with it. It's a big change, but just read the information. Ask the questions. The answers are shocking and pleasantly acceptable. So
That might be the most ringing endorsement we've
it
heard.
works.
Great. Yes.
It works. So,
Thank you, Bill, for
yeah, sure. Thank y'all.
Thank
for
you.
sharing.
Happy to be here.
Thanks, Allison.
Thank you.
Thank you, guys.